Hey everyone, Kevin Chowning here, Healthcare Industry Lead at Apps Associates. Welcome to our first in a series of episodes regarding supply chain in healthcare. In today's episode, we'll be talking about Oracle PAR replenishment in healthcare. Managing supplies efficiently is crucial for any healthcare facility, and today we'll find out how implementing Oracle's innovative features are changing the game. Joining us is Chris Wise. Chris is an Apps Associates Delivery Manager in Healthcare Solutions.
Hello, everybody. Hello, Kevin. Glad to be here today. I look forward today spending some time with you talking about some of our implementation experiences in healthcare, and today really specifically about some of Oracle's PAR capabilities.
Okay, thanks, Chris. Let's dive in. Could you start by sharing some of the inventory challenges that you've seen in some of the healthcare institutions that we've worked in? I know at this point you've worked in multiple healthcare institutions deploying the Oracle PAR solution.
Sure, Kevin. It's very common for hospitals to have trouble in this area. They either have overstock or understock. A lot of times this leads to puts a lot of pressure on the client or the patient facing staff. They're always looking for materials or not having enough, or a lot of times having too much. It's inefficient and it costs a lot of money sometimes as well.
Yeah, that sounds stressful. Can you explain how Oracle PAR replenishment addresses some of these issues?
Sure. Oracle's PAR capabilities really are about giving caregivers flexibility to make sure that they have material on hand when they need some. It's really extends beyond inventory management. We want to have solutions that allow the healthcare facilities to allocate resources more effectively, reducing waste. Ultimately, the best thing that we can get is the best patient outcome.
Okay, that makes sense. Let's dive into some of the specific replenishment methods that Oracle PAR can handle. The first one I've heard about is the PAR count method. Can you explain how that works?
Sure. The count method is really the most straightforward, most simple, the easiest to implement. And it really relies on the fact that, some of the staff knows a little bit about the material that's in that room. They visually go in, see what looks like it's short. They simply have to count it, and the system will reorder what they need to. For example, let's say that there's an item in a room that's always supposed to have 100 units. Maybe that caregiver knows just visually, what 100 units looks like, and it looks like it's lower than that. They simply go in, count those units, 2 clicks, and that item is reordered.
Okay. So it's kind of like setting a threshold, and then when the system knows when to reorder, when it drops below that threshold.
Exactly right. It's a great way to automate replenishment, especially on high usage items, things that move fast, things that, the staff kind of knows what's there, and they can identify when things are short.
Okay. Next, let's talk about the two-bin method. How does that differ from the other methods we've discussed?
So the 2-bin method is very similar to the count method. What we're really counting on, though, is that the caregiver is their visual indicator is the fact that one bin is empty. So as long as they see that one bin is empty, they simply move it out of the way for someone else to scan, or they can scan it, move it out of the way. The fact that they scanned it is the replenishment request. So we will move the second bin forward, have our materials in place, and in the meantime, the other material is on the way.
Okay. So there's always a second bin while the first one gets refilled, correct?
Exactly. That's the method that's great for fast moving items, critical supplies. The caregivers only have to identify when a bin is empty, move it out of the way, and wait for the new stock to arrive while they still have stock that's ready for them to use.
Okay. So how about the request method? It seems more flexible. How does it work?
Sure. The request method really is the most flexible and really on time. In this case, the caregivers simply have to say exactly how many of any item that they want. So if they walk up to an item, barcode that item using a mobile device, and just identify how many that they need or want at that location. So it's very good for things that are on demand, where you might see a spike in material, things like that.
Okay, so this method offers really on-demand ordering if something is needed outside the usual inventory management.
Again, that's true. It's really great in fast-paced environments where fast-paced items that move fast, unexpected spikes, maybe there's more urgent demands suddenly, things like that.
Okay, so one more for today. It's the final one that I'll mention. It's called Kanban. How does that work in a healthcare setting?
So Kanban really isn't a method that Oracle offers, but there is enough flexibility in all of the methods to implement Kanban methods. And really what this means is that there's some kind of visual indicator, similar to 2-bin. The visual indicator is that something's empty. Visual indicator here could just be a big red card that has the barcode for that item on it. So when a caregiver sees that card is showing, they simply have to scan it, and that will reorder the number of supplies that would bring that bin back up to full capability.
Okay, so that sounds simple but effective. So the idea is that when a card shows up, we know it's time to reorder.
Exactly. They just have to see it, scan it, and items are on the way.
Okay. So it sounds like each of these methods has its own strengths. Can they be used together for more efficient inventory management?
Sure. It's very common that healthcare facilities use more than one of these methods. They may use PAR, count method, for routine supplies. They may use Kanban for those items that are require visual monitoring. They might use the 2-bin system for things that are very fast moving. And then ultimately you have the request method that says at any given time, I can one-off order anything I need.
Okay. Chris, this has been very informative, and it's clear that Oracle PAR replenishment, especially with the help of mobile handheld devices, is a very powerful tool in managing inventory in healthcare.
Thanks, Kevin. I was glad to spend time with you today. Really effective inventory management can make a difference all the way down to what kind of care that we give to the patient. So ultimately, what we want is good patient outcomes.
Yep. Thanks again for joining us today, and thank you to our viewers for watching. Be sure to follow Chris and myself on LinkedIn for more insights on healthcare technology and best practices. Have a good day.